Shoulder bursitis causes and treatment. Shoulder bursitis describes one of the shoulder bursa becoming inflamed. Bursitis begins as the affected bursa is subjected to a blunt force or more pressure or friction than the structure can withstand. During trauma, the affected shoulder bursa may fill with blood and become inflamed. During pressure or friction injuries, the bursa may begin to produce too much lubricating fluid. If the friction or pressure continues, then the bursa begins to fill with the excess fluid and becomes inflamed. Shoulder bursitis may also be caused by infection, septic bursitis. This may be a systemic infection, but is more often a localized infection after a direct trauma produces an open wound near a shoulder bursa. Symptoms include localized pain, swelling, tenderness to the touch, warmth to the touch, and redness. Shoulder motions may produce a deep, dull ache, burning sensation, or pain severe enough to limit motion, and laying on the affected shoulder may cause pain to worsen and can interfere with sleep. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the sinew herbal ice on your shoulder to reduce redness, swelling, and inflammation while dispersing accumulated blood and fluids to help restore normal circulation to the shoulder. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your shoulder with acute sinew liniments to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your shoulder with chronic sinew liniments to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Apply the sinew injury poultice on your shoulder to significantly stimulate circulation and blood flow to damaged tissues, relieve residual pain and stiffness, and further promote the healing of overstretched tendons and ligaments. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.